I'm Dr. Annette Clark-Brown with QuickMD. I'd like to talk to you about stigma around treatment for opioid dependence. This is a tough conversation. I've had so many stories of patients that have gone to a pharmacy, for example, and they feel judged when they're just trying to pick up their medicine. Or maybe if a person standing near them hears that their Suboxone is ready or their Subutex is ready, they feel that they're looked down upon by the person standing right next to them. Things like that can keep a person from seeking treatment. It can make them feel like they have some sort of failure in life, that they did something wrong. Stigma is out there. It's just a reality of substance treatment for all substances, really. I think, the public tends to look at any sort of substance dependence as some sort of moral failure. But in our world, in the addiction medicine world, we treat substance dependence as a chronic disease or illness, if you will, no different than any other. We have evidence that, when you have issues with dependence on substances, that's genetics in a lot of cases. And so, you can't choose that. You can't choose your genes. And so, if your great grandma, great grandpa passed something down to you, you really don't have an option there. It doesn't mean that you'll end up with substance dependence. It simply means that there's some things that are not in our control. So what can we do about stigma? I think, it depends on who we're talking about. In the doctor pharmacy world, we need to hold people accountable for treating patients poorly because they have substance dependence. I do not mind picking up a phone and calling a pharmacist who treated one of my patients poorly. It's not the right thing to do. They're just trying to get help. We need to normalize that substance dependence is chronic. It is relapsing in some cases, and it requires treatment. We don't need to treat it like some sort of moral failure. I think the other thing we need to do is sort of get the word out, get more people getting treatment, have more avenues for them to get treatment. I'm very thankful that we have access to treatment now with companies like QuickMD, where patients can no longer have to take off work to come to an appointment, that they can come straight to me, they can take a break, they can go sit in their car and they can have their visit and they can get the medication and counseling that they need. This is what we need to be doing, making it more accessible to patients and talking about it. We also need to educate families in some cases. Sometimes families can be unhelpful. They love you, but they don't understand why Uncle such and such is, has an alcohol problem, or why they have a pain pill problem. And so sometimes bringing them along, if they're willing to explain to them what the process is, why they need medication, why they need counseling, et cetera, can be very helpful. So I think there's lots of work to do in terms of stigma, but I think that we just keep plugging along at it. We keep making it known to the general community that we have a problem in our country. For a long time, doctors were giving out medications. Pain was the fifth vital sign. So patients were getting pain pills. Then there's lots of stuff out there on the street. We need to talk about the dangers of substance dependence, and we need to make sure that patients feel that they're going to get quality care, that they're going to get compassionate care. And I tell any patient, if you feel like a doctor didn't treat you well, or you felt judged, that's not the doctor for you. You need to find someone else. Find someone who's going to listen to you, who's going to care about what you're going through, who's going to work with you to get you to recovery.